My name is Dr. Kalu Okorie. I'm the consultant cardiologist. I'm the head of cardiology department, Cedarcrest Hospital. I also head the cardiac catheterization lab. In the Cath Lab, like the one we have in Cedarcrest Hospital, we're able to look at the blood vessels supplying the heart. So in terms of diagnosis, we're able to identify areas in the blood vessel that are blocked. That way, we can as well also go ahead to do some interventions like opening up these areas. Traditionally, what we've had in Nigeria has been places where you have open heart surgeries, okay, which is an extensive procedure where you open up the heart. But actually, the Cath Lab helps you to repair certain valves in the heart without necessarily doing an open heart surgery. And we have interventional cardiologists on ground who does this procedure. We're also able to put what we call pacemakers. Now, for patients who also have heart failure, especially advanced heart failure, we can also put what we call ICDs, that's defibrillators. These ICDs helps to prevent sudden cardiac death in patients who have advanced heart failure. We're also able to work on the blood vessels that supply the kidneys. Certain people have what we call renal artery stenosis. What this means actually is narrowing of the blood vessels that supply the kidneys. Through the catheters, we can make diagnosis of areas of the blood vessels that are actually blocked, and we can go ahead to open up these blocked blood vessels, thereby saving the limbs and also saving the brain. In certain situations of stroke, if the patient presents early in the Cath Lab, we can do some interventions and open up areas of blood vessels supplying the brain. These are things that we've been able to achieve and we are doing currently in Cedarcrest Hospital, Abuja. People do not need to travel outside the country to have these procedures done. We have interventionists, we have experts that are able to get these procedures done here in Cedarcrest Hospital, Abuja. This procedure usually lasts within 30 minutes to an hour. It's life-saving, it's innovative. You don't need to go outside of the country to have these procedures done. We are doing this right here in Cedarcrest Hospital in Abuja.